A 68-year-old gynecologist, Dr. Paul Becton, who practiced over 30 years in Arkansas, took pictures of women's private parts during pelvic exams with his cell phone. He was sentenced to 36 months on 4 charges of video voyeurism and forced to register as a sex offender. He was very well respected in the community. He was a member at a Baptist church and the medical director of a pro-life pregnancy center. He was also on the board of directors for several organizations, including Fellowship of Christian Athletes in Northwest Arkansas. He also volunteered at a charitable medical clinic. He owned Becton's Women's Clinic in Paragould beginning in 2007, which was closed in 2014 when he was arrested. Many women were referred by their family members or friends to Dr. Becton because he was seen as a family man and a Christian. Many people in the community were shocked. In fact, when the news first came out in April 2014 that Dr. Becton had taken some pictures of women's private parts, a number of people, especially Christians, were in disbelief that he could have done this. Here are some comments from patients who commented on articles in the news about Dr. Becton. One former patient made these comments. "He was always very nice and professional at my visits, and both C-sections. I did not ever get a weird vibe from him at all." Another former patient shared this. "Dr. Becton was a great doctor and was very professional all the years I've seen him in Northwest Arkansas. I'm so sad about hearing this and wish it wasn't true." One lady shared that Dr. Becton saved her life when she had cancer and that he was a good doctor. It's sad that many Christian women were fooled by him. The reality is, he was a wolf in sheep's clothing. Here's a screenshot of one of the articles about Dr. Becton in the news. Countless other doctors, especially gynecologists, have committed voyeurism and many of them are never caught. We wanted to mention another example of male gynecologists who took pictures of women's private parts for years without their knowledge with a pen camera, which is more difficult to detect than a cell phone camera. Look at a picture of this pen with a hidden camera. Look at the small dot on this pen. Most people would never know that this pen had a camera. You can find a lot of pen cameras on the internet, including Amazon, that you can purchase. A well-respected male gynecologist, Dr. Nikita Levy, who was at Johns Hopkins Health System for over 25 years, secretly took pictures of his patients with the pen camera around his neck for a long time before he was arrested. Dr. Levy was only caught when a female colleague, a technician, noticed that the pen was in fact a camera and alerted the authorities. She had her suspicions confirmed when she secretly took the pen that was usually hanging on a lanyard from Levy's neck, plugged it into her home computer, and saw inappropriate images of his patients. Police later found an extraordinary amount of evidence at Levy's home, says a police officer quoted by ABC. This included over 1,200 videos and 140 images on his home computer. Think about how these women were further violated by having their nude images being viewed by teams of police personnel. Dr. Levy delivered many babies and helped a lot of women with female health problems. He was well respected in the medical community. His wife was a nurse at the hospital, too. Many people say he was a super nice person and very caring. He was a family man with children who was involved in the community. Dr. Levy committed suicide after he was fired from the hospital. In a note left for his wife, he said, in part, "I am sorry, but I could not bear to see you suffer with this truth." Here's a picture of Dr. Levy holding a baby that he most likely helped to deliver from a New York Post article. If it had not been for that technician who courageously reported Dr. Levy, it is likely that he would have continued to practice without anyone finding out that he had been taking pictures of women's private parts. Medical professionals, such as nurses, are often afraid to expose a doctor's criminal activities for fear of being fired or facing discrimination in the workplace. Imagine how countless doctors are able to get away with voyeurism without anyone knowing. A hidden camera could be put in a doctor's stethoscope or something else, such as a necktie, which would likely be harder to detect than a pen camera. A doctor who wants to secretly take pictures of a woman's private parts will do anything possible to keep anyone from finding out. This is exactly what Dr. Levy did by having a pen camera.